Hello, good afternoon, everybody. I'm Dr. Himanshu Mathur on behalf of Jaipur Rehab. I welcome everybody of you for the third part of RPSC 2020 Physiotherapist Examination Paper Solving. बड़ा मजा आ रहा है लास्ट दो सेशंस जो मैंने देखे और जो रिस्पॉन्सेज मुझे आप लोगों के मिले. सो आई एम सो हैप्पी टू सी दैट यू पीपल आर सो इन्वॉल्व्ड इनटू इट. आई एम रियली वेरी हैप्पी. ऑल्दो मैं एक बात पहले भी कह चुका हूं, मैं फिर कहना चाहूंगा कि जरूरी नहीं है जो मैं जवाब इसमें दे रहा हूं कि आरपीएससी के भी जवाब वही हो. आंसर की में जरूरी नहीं है कि वही हो. आई एम जस्ट एक्सट्रैक्टिंग आउट मैक्सिमम इंफॉर्मेशन फ्रॉम एवरीवेयर ताकि आप लोगों को सही इंफॉर्मेशन मिल सके, राइट. एंड द डिस्क्रिप्शन इज टोटली योर्स कि आप किस इंफॉर्मेशन को लेना चाहते हैं, राइट. So I'm really happy with the responses that you people are getting. हमारी जो IT टीम है वो constantly आप लोगों को respond किए जा रही है उसके ऊपर. So उनका भी काम बढ़ गया. So that's really a good part about it. चलिए आज का भी दिन हम शुरू करते हैं with the third part. Questions starting, the next 25 questions starting. मैं सीरीज शुरू करता हूँ. चलिए जी. Just a second. मैं मेरे अपने औजार ले लेता हूँ and then I'll be starting it. Okay. I hope the screen is visible to you people. I hope the screen is visible to you people now. I'm just making it just a second. Let me make things visible for you people very firmly. चलिए जी. तो रोज रोज इंट्रोडक्शन नहीं दूंगा. मेरा इंट्रोडक्शन मतलब का भी नहीं है, काम का है कि हम क्वेश्चंस कैसे रिजॉल्व कर रहे हैं, राइट. सो द फर्स्ट क्वेश्चन फॉर यू पीपल कमिंग योर वे. अच्छा, एक और चीज बता देना चाहूंगा. आज कुछ क्वेश्चंस क्लिनिकल भी हैं, तो आई एम नॉट रियली श्योर कि जो रीजंस या जो जवाब मैं दे रहा हूँ दे आर परफेक्टली फाइन. अगर वो परफेक्टली करेक्ट नहीं है तो आई वुड रिक्वेस्ट माय क्लिनिशियन फ्रेंड्स जो भी देख रहे हैं, जो कि क्लिनिकली एक्टिव लोग हैं, प्लीज अपने सजेशंस दीजिएगा मुझे. क्वाइट पॉसिबल कि मैं गलत हूं, लेकिन आई ट्राई टू बी मोर रीजनेबल अबाउट इट, राइट. चलिए, आई वुड ऑलवेज इनवाइट योर सजेशंस ऑन इट, राइट. चलिए, तो पहला सवाल जो आ रहा है आज के लिए, द फर्स्ट क्वेश्चन कमिंग राइट हियर वी गो. All are complications of fractures except vascular injury, compartment syndrome, hemarthrosis या फिर avascular necrosis, right? चलिए, तो आपका समय शुरू होता है अब. हम लोग आपको देंगे, चलिए 16 seconds. I'll give you 6 seconds here, 10 more seconds I can give it to you. Okay, last 10 seconds to go everybody. I want your answers in the comment box. बहुत कम लोग हैं जो comment box में अपने answers लिख रहे हैं, और in fact okay, and your time's up. So there are a lot of early complications of fractures except for avascular necrosis, right? तो अब क्या है, life threatening early complications क्या हो सकती हैं वो हम अभी फटाफट से देख लेते हैं इसके अंदर. It could include vascular damage. किधर गया ये रहा. एक second, I think this is not working here. Just a second. Still it's not working. Just a second. Just a second. My pointer is not working properly. Chaliye, I'm not sure why it's not working. Otherwise, it should have been working. Usually it does work. I don't know today why it's not working. Must have been some connection issues into it. Sorry. So, threatening complications could be vascular damages. Okay, patient with multiple rib fractures. In cases of elderly, loss of mobility may result in pneumonia, thromboembolic diseases, and rhabdomyosis. Vascular injuries could be local, visceral injuries causing damage to structures like brain, lung, or bladder, damage to surrounding tissues, nerves, or skin. Hemarthrosis, compartment syndromes could be one. Wound infection, fracture blisters. Systemic could be fat metabolism, shock, thromboembolism, exacerbation of the underlying disease such as diabetes, coronary artery disease, or pneumonia, right? So the correct answer for today will be avascular necrosis, right? Answer number 4. Moving rapidly on to question number second. The question number second, here we go. Which type of electrotherapy, in which type of electrotherapy patient is a part of the electrical circuit, right? The option is ultrasound, shortwave diathermy, microwave diathermy, or infrared radiation. Your time starts now. 14 seconds. Easy question है बहुत. चलिए जी, last 10 seconds to go for everybody. Last 10 seconds to go for everybody. And that's it. So the correct answer is shortwave diathermy. So when SWD is applied by the condenser field method, the electrodes in the patient tissue form a capacitor, the capacitance of which depends upon the size of electrodes and the distance material between them. So when the oscillator and resonator circuits are in tune with each other, there is maximum power transfer to the patient. All right. So the second option, that is B, SWD, is the correct answer, right? That brings me to question number 3 of the day. Question number 3, here we go. All of the following, which muscles is not useful in the crutch walking? Not useful. I would repeat it again. It is not useful. Okay, read the question carefully. So is it shoulder depressor and adductor, elbow extensors, wrist flexors, or finger flexors? And your time starts now. 18 seconds for you, right? 18 seconds. Here we go. And last 10 seconds to go, everybody. Please do write your answers in the comment box. Last few seconds to go, and the time is up. Now let us see what are the muscles that are used in crutch walking. It should be shoulders, depressors and adductors, elbow and wrist extensors, finger flexors are also used, right? So wrist flexors are those muscles which are not used in crutch walking. So option number C would be the correct answer for the day, right? For question number 3. The next question that is coming up onto here is question number 4. Without losing any more time, let us move on to question number 4 of the day. Okay. Shortwave diathermy is contraindicated in cases of recent ankle injury, acute back pain, chronic arthritis, or external fixator and in the tissue, and tissue, external fixator in the tissue, right? So easy question, straightforward. I will give you lesser time this time. Okay, not more than 10 seconds. Here we go. 10 ही seconds. Jaldi se. Write your answers in the comment box. The time is about to get up. Please do write your answers in the comment box, and your time's up. So usage of SWD, that is the pulsed SWD is देखो भाई सबसे बड़े जो confusing options होते हैं इसमें वो option होता है आपका A में, क्योंकि आपको लगता है कि यार अगर हेमार्थ्रोसिस एसोसिएटेड है या फिर स्वेलिंग एसोसिएटेड है या फिर कोई दूसरे तरीके का वैस्कुलर इंजरी एसोसिएटेड है एंकल इंजरी के साथ साथ, तो कहीं हम इसको कॉन्ट्राइंडिकेशंस में तो ना माने, लेकिन pulsed SWD has been recommended to be used in cases of recent ankle injury also, right? Ankle sprains to be used है. Acute back pain में हम लोग use करते हैं इसे, chronic arthritis में हम लोग use करते हैं इसे anyways, right? So external fixator in the tissue, because it's metallic, so it is also recommended not to use SWD in the area containing or close to the metal. ठीक है ना? आप लोग हमेशा याद रख सकते हैं बार फिक्सेटर्स या इलिजारोव टेक्निक अगर आप देखते हैं तो उसमें भी देयर इज अ मेटल अराउंड द टिश्यू, राइट? तो यू विल नॉट अप्लाई, ओके, ओवर दैट. सो द करेक्ट आंसर फॉर क्वेश्चन नंबर 4 वुड बी external fixator in the tissue. Okay, so the next option that is coming, the next question for us coming up here is question number 5. Question number 5, here we go. Any passive device which is capable of storing electric charge is called dielectric, insulator, capacitor या फिर conductor. बहुत straight forward easy सा question है. So we'll be giving you answers and we'll be giving you time, lesser time for this. Your time starts now. Okay, I'll stop on the 5 of the next second. 5 more seconds to go, everybody. And your time is about to get up. चलिए जी. So dielectric is an insulating material or very poor conductor of electric current. An insulator is a material that does not conduct electric current. Capacitor is an electric circuit, behaves as a charge store device, and a conductor is an object or type of material that allows the flow of charge, electric current, in one or more directions, right? So for us, capacitor, option number 3 is the correct answer for you, right? Easy sa question tha, straightforward. Okay. Moving on to question number 6 of the day. So question number 6, here we go. All are common deformities seen in rheumatoid arthritis except Bouton's deformity, swan neck deformity, claw hand deformity या फिर ulnar deviation deformity. बहुत straight forward question है, सीधा सा question है, कोई technical दिमाग लगाने की जरूरत नहीं है. Time starts now. Okay, we'll give you 10 seconds more after this. Okay, चलिए, total 13 seconds हो गए आपके लिए. Straightforward, your time is about to get over and your time is up. So common hand deformities seen in RAR, Bouton's deformity, swan neck deformity, palmar subluxation, ulnar deviation, mallet finger deformity, thumb deformity type 1, type 2, type 3, and mutilance or opera glass hand deformity. Okay, so in सब में से क्या चीज नहीं मिली हमें, वो थी option number C, that is claw hand deformity. So correct answer is the claw hand deformity, which is not seen in cases of rheumatoid arthritis, right? So we are moving forward rapidly on question number 7 of the day. Question number 7, here we go. All of the following pathway which is not responsible for pain sensation. Again, very straightforward answer. बहुत ज़्यादा time नहीं चाहिए इसके लिए आपको. Is it spinothalamic pathway? Is it spinoreticular pathway? Is it spinotectal pathway, or it is a corticospinal pathway? Okay, your time starts now. 20 seconds I'm giving it to you, क्योंकि इसका जब मैं आंसर दूंगा ना आप लोगों को, तब आप लोगों को शायद पता चलेगा कि हाँ 20 seconds required क्यों थे. शायद ऑप्शंस को देख करके 20 seconds required ना हो, लेकिन जो गलत ऑप्शंस हैं उनके लिए 20 seconds required हैं. Okay, so your time is about to get up and done. अगर मैं बेसिक क्रिटिकल दिमाग लगाऊं तो इसमें से जो पहले 3 ऑप्शंस हैं A, B, C, they are ascending pathway. Corticospinal is a descending pathway, so it brings out the motor response, right? It carries the motor response. ठीक है ना, तो वो आ रहा है response लेकर के. बाकी 3 है जो sensations ले जा रहे हैं, तो बात ही खत्म हो गई वहां पे. ठीक है ना, तो वो सेंसरी तो है ही इसमें 3 जो sensations लेकर के जाते हैं. एक तो मोटर है जो लेकर के आ रहा है, descending pathway है, तो सीधा सीधा इस लॉजिक से आप खत्म कर सकते हो इस आंसर को, जल्दी से खत्म, 10 सेकंड वाला. अब अगर आप थोड़े से ज्ञानी हैं और अगर आप फिजियोलॉजी की बुक्स में जाएंगे या कोई न्यूरो की बुक अगर आप रेफर करेंगे, तो आपको पता चलेगा कि यार इसमें तो सिर्फ स्पाइनोथैलेमिक पाथवे ही है जो कि पेन एंड टेम्परेचर कैरी कर रहा है. बाकी कुछ विजुअल रिफ्लेक्स कैरी कर रहे हैं, कुछ दूसरे सेंसेशंस कैरी कर रहे हैं, तो ऐसा तो नहीं है. तो फिर हमने भी थोड़ा सा डिटेल में गए इसे, और हम लोगों ने हर क्वेश्चन के साथ साथ रेफरेंसेस ऐड कर रखे हैं आज, ताकि यू कैन ऑल्सो, इफ यू डू नॉट बिलीव माय आंसर्स, यू कैन डायरेक्टली गो ऑन टू द रेफरेंस एंड चेक इट आउट, राइट? तो हमें पता चला कि spino-reticular pathway is also involved in controlling the descending modulation and motivational effective aspects of pain, and also in motor and neurogenerative responses to pain. Spinotectal pathway plays an important role in the control of inhibition of pain. It originates in the spinothalamic tract and terminates in the inferior and superior colliculi of the brainstem. Okay, so do remember that spinoreticular and spinotectal pathway also plays some significant role in pain inhibition and control, right? Corticospinal tract सीधी सी बात है, descending pathway है, controlling the motor responses, right? So our answer for this question would be option number D. ठीक है ना? चलिए, moving forward for the question number 8 for the day. Question number 8, here we go, right here in front of you. Which is the heat transfer mechanism in which gross movement of molecule occurs within the fluid? आसान सवाल again. Conduction, convection, thermal radiation या फिर evaporation. And the time starts now. 16 seconds देंगे चलो आपको, ठीक है ना? Although 16 seconds worth नहीं है इस question के लिए, but still that's perfectly fine for us. चलिए जी, and your time is about to get up. Chaliye. The answer that is coming our way is convection is the heat transfer of internal energy into or out of an object by physical movement of the molecules within the fluid that transfers the internal energy along with its mass. Okay. So the option B is correct for question number 8 for the day. Chaliye ji. Moving on to the question number 9 for the day. Question number 9. Here we go. When any stress is applied to a bone, the trabecular within that bone develop and align themselves to adapt to these lines of stress known as Lakshman law, Laxman law, Newton law, Wolff's law, or Pirani's law. Your time starts now. 10 seconds, not more than 10 seconds. It does not worth it. Okay. ये चीज सबके टिप्स पे हमेशा होनी बहुत जरूरी है. Right? Your time's up. And the answer is Wolff's law, which is a simple ideology that states that the natural bone of a healthy animal or a person will adapt to the stress under which it is placed. Okay. So Wolff's law is the correct answer. That is option number C. Right? That brings us to question number 10 for the day. So question number 10, here we go. All are common causes of Volkmann's ischemic contracture except supracondylar fracture of humerus in children, traumatic severe bleeding in forearm, undisplaced fracture of the wrist bone, tight cast or bandage of the forearm. And the time starts now. 10 seconds, not more than 10 seconds. All right. अच्छा 12 seconds हमने दे ही दिए आप लोगों को, चलो 12 ले लो, कोई बात नहीं. So please do write your answers in the comment box and your time is up. So the correct answer that comes over here is option number C. Because supracondylar fracture mein there is an injury to the brachial artery which eventually leads to ischemia of the forearm muscles. Traumatic severe bleeding of the forearms में वैसे ही forearm and hand muscles का जो है ischemia हो सकता है. Tight cast और bandaging में compartment syndrome it can lead to. So all are the probable mechanisms of VIC except for undisplaced fracture of the wrist. ठीक है ना, wrist bone. अब wrist bone में कौन सी bone है इन्होंने नहीं बताया. There could be radius, there could be ulna, anything like that, right? So option number C could be the correct answer हुए है. Okay, चलिए जी move करते हैं question number 11 पे. So question number 11, here we go. In decurvin syndrome, the involved tendons are extensor pollicis brevis and adductor pollicis longus. Extensor pollicis longus and extensor pollicis brevis. Okay, दोनों pollicis brevis. Extensor carpi radialis, abductor pollicis longus, extensor pollicis longus, and abductor pollicis longus. And 10 seconds. Starts now. And I'm waiting for your answers. Come on, come on, come on, come on. Everybody, everybody, everybody. Please, please, please do write your answers in the comment box. I'm waiting, waiting, waiting. And अच्छा time खत्म हो चुका था. चलिए जी. The correct answer is abductor pollicis longus and extensor pollicis brevis. यानी कि option number पहला, option number first is the correct answer for this. Okay. चलिए. Moving on to the question number 12 of the day, and here we go. Which is not a superficial volar muscle of the forearm? Pronator teres, flexor carpi radialis, flexor digitorum profundus, or flexor carpi ulnaris. And your time starts now. Only 9 seconds. Chalo, khatam baat. Not more than that. Chaliye. Your time is about to get over because बहुत straightforward question था. So these are the superficial muscles of forearm except for option number C, that is flexor digitorum profundus. ठीक है ना? Pronator teres, flexor carpi radialis, flexor carpi ulnaris, palmaris longus, flexor digitorum superficialis are all the superficial muscles except for the flexor digitorum profundus. It is a deeper muscle. Okay. So option number C is the correct answer for question number 12. So here we go for the next question of the day, and that is our question number 13. Severe intractable pain which becomes worse at night, relieves on exercise, morning stiffness is there for more than 30 minutes, ESR with weight loss, and the diagnosis is. ये अच्छा question है और इसी question में I would require some suggestions from my clinician friends that if I am going right or not. The options are option number A, osteoporosis, option number B, ankylosing spondylitis, option number C, spondylolisthesis, or option number D, recent spine fractures. And your time starts now. 17 seconds is what I'll give you. Chaliye ji, chaliye. Fatafat, fatafat. You can also share your logics behind this. Okay, and your time is about to get up and done. चलिए जी, इस सवाल के जवाब में there could have been osteoporosis also, there could have been ankylosing spondylitis also. Spondylolisthesis में nocturnal pains नहीं होते हैं, ठीक है. अच्छा, अगर क्लासिकली में देखने की कोशिश करूं, नाइट पेन है और ESR एलिवेशन है और लॉस ऑफ वेट है, ये तीनों क्लासिकल साइंस होते हैं टीबी स्पाइन के. अगर इन्होंने लिखा होता है रीसेंट स्पाइनल फ्रैक्चर बिकॉज ऑफ ट्यूबरकुलोसिस स्पाइन, टीबी स्पाइन या पॉट स्पाइन लिखा होता, तो शायद हम डायरेक्टली दे देते उसको, ठीक है ना. आप लोगों को याद होगा, मैं कई पिछले लेक्चर्स में ये बात बोल चुका हूं दैट नॉक्टर्नल पेन इज अ फीचर ऑफ 3T, दैट इज ट्यूबरकुलोसिस, सॉरी, ट्रॉमा, टीबी एंड ट्यूमर, ठीक है ना. तो इन केसेस में बहुत कॉमन होता है, ठीक है. तो अब ट्रॉमा केस में इफ इट इज रीसेंट स्पाइन फ्रैक्चर वी कैन कॉल इट एज यस नॉक्टर्नल पेन कुड बी देयर. लेकिन अगर टीबी होता तो वेट लॉस को भी मैं जस्टिफाई कर देता वहां पे, सडन वेट लॉस को मैं नॉक्टर्नल पेन को भी सिग्निफाई कर सकता था वहां पे. अच्छा, एनकाइलोजिंग स्पॉन्डिलाइटिस में आई कैन जस्टिफाई ईएसआर, I can justify morning stiffness, and I can also justify the stiffness or pain which could be released by exercise. ठीक है. ऑस्टियोपोरोसिस की अगर हम बात करें तो नाइट पेन बहुत ज्यादा नहीं होता, मॉर्निंग स्टिफनेस वहां पे हो सकती है, ठीक है ना. मॉर्निंग स्टिफनेस कुड बी देयर. ईएसआर आई एम नॉट श्योर अबाउट इट, लेकिन वेट लॉस बहुत कॉमन वहां पे नहीं होता. हाइट लॉस जरूर हो सकता है बिकॉज ऑफ द लॉस ऑफ द हाइट इन वर्टिब्रल स्पाइन. सो प्रेजेंट कंडीशंस में अगर रीसेंट स्पाइन फ्रैक्चर को मैं जस्टिफाई नहीं कर पा रहा हूं बहुत सारों से, तो मुझे मैक्सिमम जो यहां पे लग रहा है दैट कुड बी एनकाइलोजिंग स्पॉन्डिलाइटिस, ठीक है ना. क्योंकि ईएसआर एलिवेशन भी होता है, मॉर्निंग स्टिफनेस भी हो सकती है, पेन एंड स्टिफनेस व्हिच कुड बी रिलीज्ड विद एक्सरसाइज, that could also be justified by ankylosing spondylitis. Okay, but I am not really in context with this that if it is a correct answer or not, right? But मेरा जवाब जो होगा वो होगा आंसर बी, और जरूरी नहीं है कि ये आंसर आरपीएससी की आंसर की में भी आपको मिले, ठीक है ना. तो आई फॉर मी द आंसर वुड बी ऑप्शन नंबर बी, and I would invite suggestions from you people that if you can bring out something जो कि एक ऐसा लॉजिक हो जो कि हमारी सारी बातों को जस्टिफाई कर दे यहाँ से, ठीक है ना. चलिए, मूविंग ऑन टू क्वेश्चन नंबर 14 ऑफ द डे. सो क्वेश्चन नंबर 14, here we go. Which nerve entrap in the cubital tunnel? Ulnar nerve, radial nerve, posterior tibial nerve और median nerve. Your time starts now. 10 सेकंड से ज्यादा नहीं इसके लिए, क्योंकि 10 सेकंड भी मुझे तो बहुत ज्यादा लग रहे हैं इसमें, ठीक है ना. And your time is about to get up. चलिए जी, ulnar nerve is the correct answer. So ulnar nerve entrapment occurs when the ulnar nerve is compressed. This typically occurs at two main sites, that is the elbow and the wrist. Ulnar nerve entrapment at the elbow is usually at the cubital tunnel. इसको cubital tunnel syndrome भी कहते हैं इस चीज को, ठीक है ना. So option number A is the right answer for us. That is the ulnar nerve. ठीक है. चलिए, that brings us to question number 15 of the day. So question number 15, here we go. Structured exercise program is not indicated in spinal cord injury patient due to the following reasons, except, okay, autonomic dysreflexia, postural hypotension, thermoregulatory problems, or weakness of the muscles. 15 seconds is what I can give it to you. ये भी एक वो क्वेश्चन है जिसमें आई वुड रिक्वायर असिस्टेंस ऑफ माय क्लिनिशियन फ्रेंड्स, क्योंकि इट इज क्वाइट क्लिनिकली रिलेटेड क्वेश्चन और मुझे बहुत ज्यादा एविडेंसेस नहीं मिले इससे रिलेटेड. ओके, बिकॉज स्ट्रक्चर्ड एक्सरसाइज प्रोग्राम नाम से कुछ भी नहीं दिया गया. टाइम्स ओवर, राइट. इसका एक बहुत आसान तरीका है जो मैंने निकाला था इसे सॉल्व करने का, दैट इज चूजिंग ऑड वन आउट. क्योंकि टॉप 3 जो ऑप्शंस हैं दे आर ऑटोनॉमिक फंक्शंस, राइट, स्मूथ मसल फंक्शंस हैं, और जो लास्ट ऑप्शन है दैट इज योर स्केलेटल मसल फंक्शन, राइट. तो स्केलेटल मसल फंक्शंस और वीकनेस इन मसल्स तो हमेशा स्ट्रक्चर्ड एक्सरसाइज प्रोग्राम को प्रमोट करता है, राइट. आई डिड नॉट फाउंड एनी रीजंस व्हाई डू वी डू नॉट इंडिकेट और कॉन्ट्रा इंडिकेट इन केस ऑफ द अदर ऑटोनॉमिक फंक्शंस, बट डेफिनेटली वी गो फॉर वीकनेस इन मसल्स को हम स्ट्रक्चर्ड एक्सरसाइज प्रोग्राम में लेते हैं, जिसको कि मैट इंक्लूड करते हैं या फिर अदर फ्लोर प्रोग्राम्स हम लोग इंक्लूड करते हैं, ठीक है ना. तो वो सारी चीजें हम लोग एक्सरसाइज स्ट्रक्चर्ड एक्सरसाइज प्रोग्राम में डाल सकते हैं, और वीकनेस इन मसल्स कुड बी एन इंडिकेटेड ऑप्शन, ठीक है ना. तो इन्होंने पूछा है कि नॉट इंडिकेटेड तो सब में है, एक्सेप्ट फॉर एक ऐसा बताओ जिसमें कि नॉट इंडिकेटेड नहीं है, इसका मतलब इंडिकेटेड है, ठीक है ना. तो वीकनेस इन मसल्स में इंडिकेटेड है, ऐसा मुझे ऐसा लगता है. लेकिन अगर कोई सजेशंस आप लोग भी देना चाहे तो योर सजेशंस आर वेरी वेल इनवाइटेड ओवर हियर, राइट. सो फॉर मी क्वेश्चन नंबर 15 का ऑप्शन नंबर डी इज द करेक्ट आंसर, राइट. So moving on to question number 16 of the day. So question number 16, here we go. Now supply of serratus anterior muscle is long thoracic nerve, dorsal scapular nerve, suprascapular nerve या फिर thoracodorsal nerve. Your time starts now. 10 seconds, nothing more than 10 seconds because this question doesn't deserve more than that. All right. And your time is up. So long thoracic nerve is the correct answer for this. मुझे बहुत ज़्यादा चीजें पढ़ने की जरूरत भी नहीं है इसमें. Option number A, long thoracic nerve, is the correct answer. So moving on to question number 17 of the day. And question number 17, here we go. Spastic diplegia is a term used when all four limbs are equally involved, bilateral lower limb involvement, bilateral upper limb involvement, or bilateral lower limb majorly involved and upper limbs only subtly involved. Direct question hai, 16 seconds is what I can give it to you. And last 10 seconds is what we have right now. Please do write your answers in the comment box because they are quite vital for me for the feedbacks, right? And your time is up. So spastic diplegia affects mostly the legs and sometimes the arm, making them stiff and contracted. So involvement of all four limbs with legs more affected than hands is spastic diplegia. So option number D is the correct answer for me, right? So this brings me to question number 18 of the day. Question number 18, there we go. In all of the following muscles, which is the commonest site of muscles? Sorry, in all of the following, which is the commonest site for the pressure ulcer in the spinal cord injury patients? Ischium, sacrum, greater trochanter और heel. 16 seconds. अब ये सवाल ऐसा है कि इसमें सारे ऑप्शन सही हैं, गलत कोई नहीं है. अगर आप ध्यान से देखेंगे तो टेक्निकली कोई आंसर गलत नहीं है. You have to choose the more correct one, the more correct one. All right, and the time is about to get up. बड़ा दिक्कत हुई इसके जवाब को एग्जैक्टली क्वांटिफाई करने में, ठीक है ना. सो कॉम्प्रिहेंसिव लिस्ट ऑफ बोनी प्रोमिनेंसेस ससेप्टेबल टू प्रेशर अल्सर इन एससीआई शुड इंक्लूड सेक्रम, इस्चियल ट्यूबरोसिटीज, यहाँ पे इस्चियम दिया है, इस्चियल ट्यूबरोसिटीज नहीं दिया है, ट्रोकैंटर्स, हील्स, मेल्यूलाई, बैक, ऑक्सीपुट, स्कैल्प एंड एल्बोज, ठीक है ना. ये तो बहुत कॉमन है. अब हमने कुछ निकाले ऐसी स्पेसिफिक रिसर्चेस, ऐसे स्पेसिफिक एविडेंसेस और ऐसे क्या कहना चाहिए जिसका की लेवल ऑफ एविडेंस बहुत अच्छा था. वहां से हमने उन सिस्टमैटिक रिव्यू से कुछ निकाला जिससे कि हमको पता चला मोस्ट प्रेवलेंट साइट ऑफ प्रेशर अल्सर इन एससीआई पेशेंट्स इज सेक्रम, ठीक है ना. सेक्रम सबसे ज्यादा प्रेवलेंट था. उसके रेफरेंसेस भी मैंने दे रखे हैं. इनफैक्ट मैंने रेफरेंसेस सभी के दे रखे हैं, सभी आंसर्स के रेफरेंसेस दे रखे हैं एक्सेप्ट द 2 ones जिनका मैंने बताया, ठीक है ना. सो ये आंसर जो था वो सही निकला. सो ऑप्शन नंबर बी इज करेक्ट फॉर 18th क्वेश्चन, राइट. So whenever you also check, please do check it at maximum. और कोई आर्टिकल्स भी अगर आप चेक कर रहे हैं तो प्लीज चेक द आर्टिकल जिसका की लेवल ऑफ एविडेंस ज्यादा हो, ठीक है. चलिए, दिस ब्रिंग्स मी टू क्वेश्चन नंबर 19 of the day. Question number 19, here we go. Which is a common progressive disabling disease of childhood? Is it spina bifida, cerebral palsy, traumatic brain injury, or muscular dystrophy? And your time starts now. 10 seconds is quite enough, I think, for this. So there we go, there we go, there we go, there we go, and अच्छा खत्म हो चुका है time, sorry. So muscular dystrophy is a group of genetic disease that causes progressive weakness and loss of muscle mass. Cerebral palsy is a non-progressive disease. Traumatic brain injury is again a trauma condition, right? Although it is quite prevalent in children as well, right? चलिए, so for me option number D is the correct answer for question number 19 for the day. So that brings me to question number 20th for the day. So question number 20, here we go. Which primitive reflex persists for lifelong? Is it tonic neck reflex? Is it parachute reflex? Is it Moro's reflex? Or is it Landau's reflex? Again, straightforward question hai. 10 seconds is enough for that. Okay. चलिए जी, फटाफट से अपने अपने आंसर्स जवाब दे दीजिए and your time is about to get up. ऑलराइट, तो ये है वो लिस्ट उन रिफ्लेक्सेस की, प्रिमिटिव रिफ्लेक्सेस की जो कि लाइफ लॉन्ग परसिस्ट करते हैं. तो उनमें से पहला है ऑप्टिकल हेड राइटिंग रिफ्लेक्स, लैबिरिंथीन राइटिंग रिफ्लेक्स, प्रोटेक्टिव रिएक्शंस दैट इंक्लूड्स डाउनवर्ड पैराशूट, फॉरवर्ड पैराशूट, साइडवर्ड पैराशूट एंड बैकवर्ड पैराशूट. एंड द फोर्थ वन इज इक्विलिब्रियम रिएक्शन. सो ऑप्शन नंबर बी, दैट इज पैराशूट रिफ्लेक्स, इज द करेक्ट आंसर फॉर इट, राइट. This brings me to question number 21 of the day. So question number 21, here we go. Glasgow Coma Scale in traumatic brain injury assesses all responses except eye opening, best motor response, verbal response, or hearing response. The time starts now. Although देने तो मुझे 7 seconds ही चाहिए इसके लिए, but I'll give you 10 seconds, right? So last 3 seconds to go more, and your time is up. So everybody knows that eye opening response, verbal response, motor response are the domains of Glasgow coma, but hearing response is not a domain of Glasgow coma. Okay, so option number D is the correct answer for question number 21. That brings me to question number 22 of the day, and here we go. Inability to interpret or recognize the information although the end organ is intact is apraxia, agnosia, dementia, or aphasia. Your time starts now. Okay, I'll give you say 10 seconds. Okay, 10 seconds is enough for this. Okay, चलो 10 seconds और दिए तुमको. चलो 17 seconds हो जाएंगे अचानक से, दिवाली के बाद भी ऑफर. Okay, and your time is about to get up. The correct answer is agnosia, which is a rare disorder whereby a patient is unable to recognize and identify objects, person, or sounds using one or more of their senses despite otherwise normally functioning senses. The deficit cannot be explained by memory, attention, language problems, or unfamiliarity to the stimuli, right? So the correct answer is option number B, that is agnosia, right? This brings me to question number 23 of the day. So question number 23, here we go. What is the minimum weight to accomplish any cervical vertebral separation in cervical traction? Is it 50 pounds? Is it 25 pounds? Is it 35 pounds? Or is it 15 pounds, right? So your time starts now. 14 seconds. Chaliye. Iske baad we'll be giving it to you 10 seconds more. Okay. Chaliye ji. And 5 seconds more to go now. Go, 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 go. And your time is about to get up. So optimum weight for cervical traction to accomplish vertebral separation is 25 pounds. Additionally, 2 to 20 mm elongation of the cervical spine has been shown to be achieved with 25 or more of the tractive forces. Cervical facet joint separation is needed or a tractive force needs a tractive force of almost 9 to 13 kilogram. Right? तो यहाँ पे vertebral separation की बात कही है, तो we'll directly go for option number B, that is 25 pounds. All right. चलिए जी. So that brings us to question number 24 of the day. Question number 24 and the second last question of the day. Here we go. All are general indications of heat therapy except pain, muscle spasm, bursitis, or hemorrhage. Right? Your time starts now. 10 seconds is more than enough for this because straightforward first year जैसा question है ये, and your time is about to get up. So hemorrhage, option number 4, is the correct answer because it produces vasodilation and decrease in blood viscosity, thereby increasing the hemorrhage conditions, right? So it is contraindicated. Option number D is the right answer. Okay, so that brings us to the last question of the day, and the last question of the day, here we go. In all the following, which approach aims to inhibit spasticity and synergies using inhibitory postures and movement and to facilitate normal automatic responses? Is it Rude's approach? Is it Broonstorm approach? Is it PNF, or is it NDT or Bobath's approach? Your time starts now. I can give you 10 seconds for this, no problem, or 15 seconds for the last answer, right? Chaliye ji. 5 seconds to go more. 5 seconds to go more. And please do write your answers, and your time is up. Chaliye, so right answer is Bobath technique. Okay, Bobath believed in inhibiting primitive reflex pattern using reflex inhibiting techniques and encouraging promoting movements in all pattern as well as combinations, right? So option number, मैंने C दो बार लिख दिया, C नहीं, ये D है. Okay, option number D is the correct answer. That is the Bobath technique. So this brings us to the end of today's session, and I thank everybody to stay here with me, and such a wonderful cooperation, such a wonderful inculcation that I have observed of you people, and involvement I've observed of you people. I'm so very blessed of this. So I expect the same sort of involvement in the coming videos also, because we are having our last video coming tomorrow. So please do join us tomorrow as well. and please do write the feedbacks of it. Although I'm constantly getting your feedbacks onto it, so please do write the feedbacks onto this video as well. Thank you so much. I sign off here, and I'll see you right